we are at the testing phase, and if you remember, we talked about the steps of change. So this is where we are, and we are prototyping the change. Now, eventually, we will be moving to implementation, right, and then spread. So let's talk about implementation. Now, there is a difference between the word we use, implementation, in a very generic term, and for this methodology, right? From a quality improvement and from this methodology point of view, implementation got a very narrow scope. Right. Otherwise, in a normal project management, implementation is just going and executing a plan. You just go and implement, right? But with this methodology, we first test and then implement, right? So what we mean by implementation here is to make the change an integral part of that system. So what it means for each team is that we tested in our pilot area, right? And we have developed interventions. We're still developing intervention. And to make it permanent in that area first, right? That's what we are saying implementation. So yesterday, I heard a lot of presentations talk about implementation, right? So implementation is different from testing. We test first, and we are at the testing phase, right? So what we're doing at the moment, we got a lot of idea how we can resolve this issue. And we're taking those ideas and testing and trying to find out what works, what doesn't work. We're trying to learn from it, right? We're not into implementation yet, because implementation need a far more associated things to be addressed for it to be implemented. But what we're trying to determine what works. That's the key thing we're trying to find out. Now, once you know what works, then we move into implementation. And implementation is a step between testing and spreading. So spreading is going beyond your pilot areas. So now, how do we know when a change idea is ready for implementation? How do we know? How do we know we are ready for a new status quo? How do we know? So we can use this matrix, which we shared yesterday as well. Now, there are three critical components here. One is the staff readiness. So if you're going to implement this, where are you on the scale of staff readiness? Right? That's the first element. Second element is your confidence. How confident are you that the change you tested is going to result in improvement? And when we talk about confidence, data is a part of that confidence. Are you confident that your data is showing an improvement and data is supporting? And data improves your confidence, because data is showing improvement, you're confident. You can say things are moving. The third thing is cost of failure, which we discussed yesterday as well. So if it's a high risk, then you want to think about it, because there is a negative outcome of implementation if it's not going to work, because you're going to lose the buy-in and all the will you have created in the front line for the change and the quality improvement. If it's not going to work, that can be a negative impact. So you need to think about the cost of failure of that implementation, right? So if you need to put these three things together and then think, are you here? Right? This is what you need to decide. We need to decide, are the change ideas here? If not, it's not yet time. Probably we need a bit more testing, right? Because the likelihood is that you're going to face more resistance and challenges, right? So quickly, probably 5 minutes, what we're going to do is you have a big A3 sheet. Can you take that sheet on the back side of it? There's a plain side of it. Go back to your driver diagram, and can you list down the things, the ideas which you think is ready to be implemented based on this criteria? So put your ideas which you think are ready for implementation and have a discussion around those ideas using this grid. Right, okay, how many ideas are ready to be implemented? 1, 2, 3, 4, so just about one. Okay, that's great. So we're getting there. So it's really good to see at least we have one idea which we can implement. So now that's really great. Okay. Do you want to feedback what it is? Auckland. Prescriber decision support tool. Okay. Mid Central, do you have any which is ready to be implemented? Right.
Third time's the charm. Nursing QCAD.
Thanks, Barbara.
Right. And Canterbury had few things on their list which they're highly confident and think is ready for implementation.
We've got our opioid dosing guideline card, nursing education program, and a welcome to the ward pamphlet.
Right.
Thanks,
Great.
Claire.
So it's really good to see that some of you're highly confident that there's some ideas which are ready to be implemented, and I'm sure you have applied all those different elements. So as we progress further, as you test more, use this matrix to see are we ready for implementation, and put all the change ideas through this grid. Right. So we all got at least one change idea. Now there are some key principles around implementation. Now implementation, like testing phase, is also a series of PDSA cycle. Right. It's an ongoing testing which we carry out through the testing, implementation, and spreading. So it's not just you just go and do it, because implementation by itself, it's a different phase, different task. And you need to figure out what is the best way to implement. So you have theories, we need to do this, we need to do this, we need to do this. You have a lot of theories how to implement this. So you just go and test and learn from it. And so you have to do a lot of PDSA in the implementation. The second thing is data. Now data is very powerful here because that will help you to change the thinking of the people, because data just shows you how many people are harmed, because those are very powerful when you go into implementation. So data is quite critical, and the support around when you're implementing, you cannot just go and give a bundle or a package and say, go for it. So the team who is in the development phase need to support those teams to understand the whole thing, because you have tested all the ideas, you know what works, what didn't work. But a person who is not involved may not know what's actually happening. So you have to hold their hands, you have to support them, you have to coach them through that implementation phase. Right? And the last thing is a social aspect. Now this is all the Deming's psychology of change, and that itself will take around 2 hours to talk about it, but we won't touch on that today, and we'll cover that in some other time. So it's about psychology of change. Right, so now when you go into implementation phase, there are different approaches how you can implement. First one is just do it. And this is applied where the change idea is very simple, it's not complex, and you just want to go and do it. Right? It's very simple. There's no complexity around it. Parallel approach. Now, there are some ideas where we can't stop the business. Right? The business has to run, but we want to implement something else as well. So we implement parallelly. Right? The business goes on one hand, and then you slowly kind of do this implementation at the parallel level and slowly take the other one out. Right? The third one is sequential. So sequential approach is when you have an intervention or change which includes multiple components, right? And you don't want to apply, you don't want to implement all of them at once. You want to go in sequential. So you do step 1 and 2, and then implement step 3 and step 4. So if you have a lot of things in the single change idea, follow the last one. So when you're going to implementation, you need to think about what approach you're going to take for implementation. Right. Now, some of the practices around improving, making the improvement permanent. Excuse me. So you have a change, you tested it, we all tested change idea. We have confidence, we are sure that it is going to work, right? So what you have is an idea which works, right? Now, to apply this idea to normalize this idea into a process, you need a lot of elements to wrap around those ideas. And these are some of those elements you need to consider while you're implementing. You need to think about standardization. So when you're applying, you're implementing that change idea, think about standardization on the floor, on that board. How can you achieve standardization? Because what you don't want you to introduce variation, that we have 5 people doing in 5 different ways. So you have to think about it. Think about documentation, what all things you need to do, because this is a new status quo. This is a new norm. So do you have to update your policies, guidelines, or do you have to update your any other documentation to make it a permanent? Because you're getting into a permanent stage. So think about your documentation. Is there any change in job descriptions? Depends on what idea you're going to propose. And how is our data collection going to be? Right. Third thing is training. Now, if a new house office or a new nurse joins, the way they were trained before was different. Now you have a new way of doing the things. So how are you going to transition from that old way of teaching or old ideas to new ideas? So think about your training, orientation training, and ongoing training. You have to adjust that according to that new idea. Measurement. Now, measurement is quite important because you still want to sustain through the implementation, and we'll talk about it later on, but you still need to maintain that measurement because otherwise we don't know if it dropped off or is it still sustaining or still working, right? And while implementation, people can see the value through that measurement. Resourcing. Now, STAMP is a excuse me, good example. We know the idea is working, fantastic, red color especially, it works. But let's talk about 1 year down the line. Is it going to sustain? There are fundamental questions. Who's going to fund this? Where is this going to be placed? What if it gets lost? So you have to think about what all resource and logistics you need around those ideas and how you're going to manage that. Because otherwise, the chances are it will drop off. What if the stamp is missing? So the process can drop off at the same time because you don't have a stamp available there. So you need to think about those logistics, how you're going to make those available, and what all other resources you need. Right, so what we can do is, this is a checklist which we can use, and this will help you to think through some of those elements here. So what we can do now, we got in 5 minutes, is that pick one idea which you think is ready for implementation, and go through this different elements of implementation and have a discussion and think what you need to do that implementation. Have you considered all these different aspects of implementation? So pick one idea and just discuss what is the best way, and also what approach will you be taking to implement that, given you know your environment. And when we talk about implementation, we're talking about implementation in the pilot area, not in the hospital. In your pilot area only. Right. So quickly, would you like to feedback 1 or 2 tables in terms of what you have identified? What are you going to do for this implementation? Any volunteers? It's your work, come on. Oh.
I guess one of our challenges was we feel we've implemented a lot of things. So where is it that you're testing and where is it that you've implemented? So if we focus on staff education, we have induction for nursing and for house surgeons, and that is now part of regular business, so it's business as usual, so that's implemented. But we haven't identified the other components of education in terms of measuring those components' effectiveness. So, and also we haven't addressed potentially the casual pool staff induction process. So I guess we've partially implemented. But it's a bit of a challenge when you're putting in an intervention and process measure as to where is it actually implemented and where is it not. Yes, you're doing it in the test area, but we made the decision not to just restrict the education component to the test area, because why would you waste the opportunity? So I probably asked more questions than I've provided.
No, I think definitely, especially when it's around education, sometimes the way it's structured and designed in DHB, you just have to do it in a department or all the orientation to house office or the front end. So it's based on what structure you have in your DHB and what you think. And again, what is your cost of failure? So if you have tested your package, education, and you think you have feedback during your testing that it is working, it's a great package, and you have all the confidence, yes, you can go for implementation. Otherwise, if you can't reverse back after providing a global level education, it's going to be a major undertaking to reverse. So that's the cost of failure. But if you're highly confident, absolutely fine. That's for you to decide how confident are you with your intervention and how wide you want to go with implementation. But we will usually start with the area where we started, and we test it, we make some improvement, implement it and sustain, and then spread to other places. Right, we have a question.
So we were talking about our risk assessment tool and the implementation for that. So the implementation dates we don't have yet because we're a wee bit reliant on one of the other services updating their documentation. They're doing a review of their documentation that we're piggybacking this off. So I guess the measure here is the number of patients that are having the risk assessment undertaken, and we need to do a wee bit more work on a PDSA cycle around just determining people's risk score and what they actually experienced. So current level of compliance about risk assessing patients is pretty poor, and we're hoping that we'll get a much better predicted level after the change. And then the other measure, I guess, is patients experiencing post-op nausea and vomiting, to see whether we're having a reduction in that as a result of a change in procedural technique prescribing based on that risk assessment. And so the processes or products affected is our APAC or anaesthetic pre-assessment clinic and updating that documentation. But we only want to do that once because there's, as I say, there's a wider organisational change happening at the moment.
And I think I was having a conversation with Alan during the session, and Alan brought a quite interesting topic, which I just want to highlight, which is this phase, which is parallel approach. Now, one of the things is once you are putting a new system or new idea in, make sure you take the old one out. Right? Otherwise, what you're doing is you are introducing that variation. It's not the system. You are introducing the two ways of doing things, and then it becomes a different quality improvement project. So make sure if you're introducing a new thing, you take the old one out or restrict it in some way that people don't go back to the old habits. And so there's a lot to talk about implementation, but we're just short of time, and it's just to give you an idea what are we looking at, and as we go forward, what are the things we need to consider. Once we are finished with the implementation, thank you, Avril. Once we're finished with implementation, the next thing is spread, right? So we are going beyond our pilot size to all the hospital. So by the end of implementation, we have a really good evidence and a really a good case that, see, we have made a difference in this place, and we are sustaining that improvement. Now it's time to go and spread to different wards, the whole hospital. So we will cover the spread strategies. There's a lot about spread, and we'll talk about it in the coming months, but I think it's a bit early at the moment. But that you need to consider that. And I think creation of bundle will also help, because you have specific change ideas, but we will also have a bundle. So we need to think this through, that how are we going to implement this bundle. Right, so that's ongoing thinking, and we need to decide how we're going to do that. So that's spread, and we'll cover this in the coming months through webinars or other sessions. So that's on implementation.